NACA National Agency for the Control of AIDS, and we are like we midwife the multi-sectorial response, but we're not the only stakeholder in the space. We have partners, donor partners, we have implementing partners, we have the civil society, we have NGOs. In Nigeria, from the last mapping that was done, we have over 25,000 health facilities across Nigeria that offer HIV treatment, testing and treatment. Aside that, we have over 15,000 non-conventional centers like traditional birth attendants, like mission houses and all that we are collaborating with, and we give to them test kits, and they can test women, particularly pregnant women and even other people that access their care, and we collect data, reports back from them. So we're doing all this to reach people, and we also have people that are working in the community. They are working using community structures like traditional rulers, market women structures, and even going door to door, to be able to access some of this. As we speak, just last week, we inaugurated a steering committee for what we call the ART, antiretroviral therapy impact survey. We're doing it in Akwa Ibom State. The minister will be flagging it off very soon, and it's part of a way of making sure that we are, in the community, so that is to assess people, assess the prevalence, determine how many of these people are actually on treatment, and even determine how effective our antiretroviral therapy. So those on treatment, how many of them are actually viral suppressed? That is, they have low viral level. So all this is, like I said, is a continuous surveillance to know, what our figures are really in the nation. There are still some people that are not on treatment, and that is why our surveillance continues, because sometimes people do the test positive, and then you tell them their status and they're afraid and they don't want to access treatment, or they access treatment once and they run away. Because when they test like that, we make sure that we link them up to treatment centers. We do a lot of counseling. We keep following them up. We keep our surveillance on them to ensure that they are put on treatment and they stay on treatment. So it's a continuous exercise. Unfortunately, our coverage amongst pregnant women in terms of mother-to-child transmission is about 34-35%, as against the global 95% target. So what we're doing, like I said, is trying to reach as many pregnant women as possible, and the media too has a role to play in this. You have a strong role to play in this to help us to advocate for every pregnant woman, to ensure that she goes to health facilities. Like I said, we have over 50,000 both conventional and non-conventional health facilities that offer HIV testing and treatment. So let's advocate for every pregnant woman to ensure that she's tested during pregnancy, and if found to be positive, to ensure that she's placed on treatment. Yes, just to assure people that the medications are safe, even in pregnancy, so they can actually take these medications in pregnancy, and even when they deliver their babies, you have medications that we give to the newly born babies to ensure that they do not contact HIV/AIDS. So this is an appeal that we should ensure this, so that we prevent, mother-to-child transmission, and ensure that no child is born HIV positive. Mentor mothers. So these are also HIV positive women that have gone through the process. Many of them have children HIV negative because they've been taking their medications. And like we said, when you take your medications, you are virally suppressed. They said undetectable equals untransmissible. U equals U. So when you hear the story of someone like you that has passed through the system, that has a similar infection, and is telling you their life story and the positive outcome, they are encouraged. So we have this in many of our rural areas. They help us, to reach out to all these other people. Like I said, we have these subnational agencies that help us to assist us, and we are even working with people like religious leaders. We have religious CSO like the NACA and so many other religious CSOs that they work with religious bodies. So when your pastor or your imam or somebody you respect preach on the pulpit and tell you about some of these things and the dangers and the outcomes and the positive outcomes, people tend to listen to them. And like I said, we also have community-based society organizations that they are known in that community, they reside in that community, so they can actually speak their languages. We have communications flyers, fact sheets written in different languages that we share amongst some of these women or general population that have such cases. So I think all and all, like I said, the media, the TV, the radio, the print media, and even our social media network. As NACA, we use the social media a lot. TikTok, we have productions in TikTok and so many other things. One of the biggest challenges is stigma and discrimination, and that is why we keep saying we should try not to stigmatize against people living with HIV/AIDS, because sometimes if people tested positive and then they know that they'll be stigmatized against, they will not want to access health, access care. They run away from going to hospitals where they can get medications for some of these things. And that is why we're saying, as Nigerians, and as the media, we should propagate the issue that HIV/AIDS is non, they are route of communication, but you don't get it by hugging and living with somebody in the same apartment and sharing offices and all that, so we should embrace them so that they can actually access care. And when they access care, it will help us to stem that tide. And part of the innovations, or part of what strategy we put in place is we have the Prevention of Mother to Child Transmission Acceleration Plan Committee that was launched by the Honorable Minister for State for Health, Dr. Tunji Alausa, some weeks back, and we've been having meetings, and we're working not only at the national level. Like I said, we are working with partners, implementing partners. We are working with donor organizations like the UNAIDS, PEPFAR, WHO, and other international organizations. And we're also working with our subnationals, like our SACAs, our State Agency for Control of AIDS, and these people also oversees our LACAs, Local Government Agency for the Control of AIDS. And I use this medium to also encourage our governors and chairmen of local governments, particularly now that they have autonomy, that they should help to empower some of these organs of government. Many of them will relate with them, but they need to be financially buoyant to be able to do many of these surveillance activities and oversight functions. Yes, generally in Nigeria, and I think it's even a similar trend globally, young women aged 15 to 49 are most at risk for obvious reasons. I think the last data says they're like 3 times more prone to coming down with new infections, and even the prevalence shows that they are like 3 times more at risk. And for obvious reasons, for biological reasons, the body structure of the woman, they are more exposed during sexual intercourse, especially if they have unsafe sexual intercourse. And of course, the socio-economic issues, in many places, women cannot negotiate sex. You can't tell your spouse or your boyfriend or fiancé to go and use a condom or something. They're vulnerable. Unfortunately, you have that level of inequality. And then, of course, sometimes you have women are more when you talk about commercial sex workers and things like that. So that really places them at a higher disadvantage, and they are more at risk. Yeah, well, there's domestic resourcing. And what we mean by that is that, just some years back, we launched the HIV Trust Fund. I would say that not much is active now, but we are trying to rejig it and rejuvenate it and ensure that we have HIV, we have a private sector, private organizations, some businesses and big philanthropists and industries, join us in this fight. So we have the HIV Trust Fund. Like I said, of course, government of Nigeria themselves, is budgeted for. We have budget allocation, which we are also advocating, for more resources in that domain. Apart from the federal government, like I said, the state government and the local government also has a huge role to play in this regard. Where there's better information, there's better awareness. I think at least the situation is better than 20 years ago or 10 years ago. I know there's an anti-discrimination law really in place that prohibits that. And we also, we're hoping that our different state House of Assembly will help to domesticate this. Some states have domesticated it, but in some states it's not yet, a law. So people can actually access this anti-discrimination law, and if they are stigmatized against, maybe in their workplaces or in their schools, and people can be fined, for as much as a year, 2 years, or even given monetary fine like ₦1 million, ₦2 million, depending on the outcome of the investigation. I know many years back we had what we call a stigma index survey. In fact, we had a couple trying to assess the prevalence or the level of stigmatization there in the community, and notice that it's dropping really. And in fact, this year we're scheduled for another survey, stigma index survey, to actually know the actual, prevalence and level of stigmatization against people living with HIV/AIDS that is in the community, and that will help us guide what we do next. And we have gender and human rights committees actually that work with the Nigeria Human Rights Commission. Just like I said earlier, HIV is a multi-sectorial thing, so it's not just NACA or just Federal Ministry of Health, but we reach out, and even the police. We do a lot working with the police and other security agencies. HIV cannot go away, like we said. What we mean by that is that people that are already infected, at least they will still be living with the disease. If today I'm found to be hypertensive, I will be hypertensive till I die. So someone that was infected yesterday and is maybe 20-year-old will probably, born with HIV today, will still live. So HIV will still be with us. But what we're trying to say that it will stop being a public health threat, we'll stop having new infections, So, but what we'll do, what will be our role as at that time, if we meet the target, God willing, is that we continue to do our surveillance, because we can't say because we've met the target we should stop surveilling. So we continue to do our surveillance, continue to make sure that we are reaching out, getting people tested, passing out the information of prevention, the prevention messages out there, so that people are not coming down with new infections, stem the mother to child transmission, because of course someone that's already infected, ensure that they stay on their medications, ensure that we provide antiretroviral drugs that are potent, and give them the necessary viral suppression. So that will still continue to be our role. And of course, even the issue of, when you're talking about domestic resource, the issue of domestic production of antiretroviral drugs is also a strategy that one can use to ensure that our investment is not too huge and something that we can manage as a country. So as NACA, we're already talking to some pharmaceutical companies that have the competency to be able to produce some of this, because as we speak now, there's no antiretroviral medication that is produced locally in Nigeria. All the medications are imported. The same thing for the test kits, the HIV test kits. So now we're talking to pharmaceutical companies to ensure that they can start local production. Of course, I haven't had all the necessary pre-qualifications and certification, to start local production of this medication. Very soon, because we are discussing. In fact, some of them are already setting up plants, some of them already have dedicated production line, but they have to get some form of pre-qualification certification, because HIV is a global disease, so you have to meet global practices, best practices, so sometimes it's not everything that is within our power locally. So we want to be sure that we have all the necessary certification. Like I said, many of these pharmaceutical companies are already producing some other medication. So like I said, many of them are now having dedicated production line to ARVs. And also some of them are working in collaboration with other international, pharmaceutical companies that are already producing some of these medications. And we as the government too, we are giving them all the necessary enabling environment and support to make it seamless.